right, let's get right into it. We're about to see one of the biggest shakeups in American nutrition policy in decades. We're going to unpack the new Dietary Guidelines, a document that is set to completely change how millions of us think about food.
And when I say flipped on its head, I mean that almost literally. The 2025-2030 guidelines that just came out are a radical break from decades of advice, and you can bet it's already sparking some really intense debate among scientists, doctors, and of course the food industry.
And here it is. This is the image that says it all. You can just forget the old food pyramid you learned about in school. The new icon is an inverted pyramid, which people on social media immediately dubbed the keto cone, and it puts protein and fats right at the top. It's a really powerful visual that tells you our nutritional priorities are being turned completely upside down.
So what's the big idea here? What's driving all this? Well, the administration is framing this as a fundamental shift in how we approach food, and they're aiming it squarely at America's growing health crisis. It really all boils down to this one simple, powerful slogan repeated by Health Secretary Robert F. Kennedy Jr. The entire 10-page document is built around this idea. Let's get back to whole, unprocessed foods as the foundation for our health.
And if you look at the official reasoning, it goes way beyond just what you put on your plate. They're connecting these new guidelines to huge national issues, like tackling the chronic disease epidemic, slashing healthcare costs, and even realigning our food system to better support American farmers. Okay, so that's the big picture, but what does eat real food actually mean when you're at the grocery store? Let's get into the specifics, because when you see them side by side, the changes are pretty dramatic.
Whoa, okay, just take a look at this table. Protein recommendations, they've nearly doubled. Look at dairy. It's a complete reversal, going from low fat to encouraging full fat. For fats, the focus is shifting away from just limiting saturated fat and more towards prioritizing fats from whole foods. They even list butter and tallow as options. Sugar gets a much tighter leash, and for the very first time, they explicitly call out highly processed foods as something to avoid.
Let's just focus on the protein part for a second, because this is a huge one. The old guideline, 0.8 grams per kilogram of body weight, that was really just the bare minimum, just enough to make sure you don't get sick. But this new number, 1.2 to 1.6 grams, that's a massive jump. We're shifting from a mindset of just preventing deficiency to one of actively trying to optimize health.
And to put that in real-world terms, if you're a 150-pound person, your daily protein target just went from around 54 grams to over 82 grams. That one change alone means you have to pretty much completely redesign your daily meals.
So, as you can probably guess, this huge pivot towards more protein, especially from animal sources and full-fat dairy, set off an immediate firestorm in the nutrition world. The debate got heated and fast.
The administration came out swinging. On their promotional website, they declared, quote, "We are ending the war on protein," basically framing this whole thing as a necessary correction of past scientific mistakes.
But on the other side, you have leading nutrition scientists like Marion Nestle from NYU, who pushed back hard. She argued that the whole premise is flawed. Her point is that most Americans aren't actually protein deficient to begin with, so why the big push for more?
And you can really see the two camps forming here. On one side, industry groups like the Meat Institute are celebrating, calling meat a protein powerhouse. On the other, you have nutrition experts who feel like this dismisses decades, literally 75 years, of research that favors more plant-based diets. And of course, social media had its say. Dietitians and nutritionists online pretty quickly came up with a nickname for that new inverted pyramid, the keto cone. It really captures the concern that these guidelines seem to be pushing a high-fat, high-protein, almost ketogenic-style diet on a national scale.
And this brings us to what critics are calling a major contradiction, kind of like a math problem that doesn't add up. The guidelines tell you to eat more animal protein and full-fat dairy, but they also keep the old rule about limiting saturated fat to under 10% of your calories. A lot of experts are asking, how is that even possible? Can you actually do both at the same time?
So this is where it gets really important, because this isn't just some dusty 10-page government report. These guidelines are the actual blueprint for huge federal food programs that affect millions of Americans. I mean, just look at the scale of this. We're talking about the National School Lunch Program, which feeds about 30 million kids, SNAP, which helps 42 million people buy groceries. Not to mention WIC, meals for the military and veterans. The influence is just enormous.
And the administration isn't waiting around. Agriculture Secretary Brooke Rollins said this marks day one of a recalibration of the rules for all of these massive federal programs.
But this is where the vision hits a wall of reality.
It's one thing to write these guidelines, but it's another thing entirely to actually implement them. How do you suddenly cut out all the processed foods that schools and other programs rely on because they're cheap and easy? It would probably take a massive investment in new kitchens, new staff, and new training to make more food from scratch.
And this is a first. The guidelines are officially taking aim at highly processed foods. Now, there isn't an official government definition yet, but the report describes them as foods made from things like extracted sugars, starches, and oils with chemical additives. So, yeah, basically a huge chunk of what's in the average supermarket.
So the bottom line is this. This whole debate over the keto cone and protein isn't just some academic argument. It's about to play out on school lunch trays and family grocery lists all across the country. And that really leaves all of us with a fundamental and kind of tough question. The whole process has raised concerns about politics getting mixed up in what should be a science-based review. So in this world of conflicting information, where science, politics, and industry all collide, who are we supposed to trust for advice on the most basic thing we do every day, deciding what to eat?